Speaking of, today is World Stroke Day, and as you may know, some symptoms of a stroke include numbness or partial paralysis on one side of your face.
But as Roland Rodriguez explains, these same symptoms could also be pointing to something else. He's at Doctors Regional Hospital this morning and joins us now live. And Roland, if not a stroke, then what are we talking about?
Good morning, guys, and good morning, South Texas. We're talking about a rare disease called Bell's palsy or facial palsy. It affects 1 in 5,000 people every year. It's typically a temporary condition that will resolve on its own, although it will take a considerable amount of time to resolve, anywhere from several weeks to months.
So Bell's palsy or a facial palsy is a dysfunction of one of your facial nerves. As far as risk, everybody's at risk for this. It's primarily found in adults, but pretty much everybody is at risk for Bell's palsy. It doesn't matter age or gender.
Signs and symptoms of Bell's palsy can come on suddenly.
Telltale signs of Bell's palsy: facial drooping on one side, drooling on one side of the mouth, the inability to close your eye. You can have a little bit of numbness in the tongue, but mostly it's the facial drooping on one side with the inability to close the eye and having a watery eye and drooling.
The first reaction of many individuals suffering these symptoms is that they are having a stroke.
The thing to be careful of is to not think that you have a facial palsy until a doctor tells you you have a facial palsy, because it can often mimic a stroke. If you have any of these problems, you really need to see a doctor to tell the difference between a facial nerve palsy and a stroke.
This disease affects approximately 40,000 Americans each year, and nobody knows what exactly causes it.
Some of the causes of the facial palsy or Bell's palsy are viruses. These include the herpes virus, which also causes cold sores. There are also the Coxsackie virus or the hand, foot, and mouth disease that you've heard of, mumps, measles. But what we do to treat it when it first starts, within the first 48 hours, we can give you steroids, which will help decrease the inflammation and shorten the length of time to resolve this palsy.
And if you'd like more information on Bell's palsy, all you have to do is visit our website at krstv.com.